Every day, millions of people take medication for high blood pressure. Two of the most commonly prescribed medicines are amlodipine and losartan. Both are effective, both are widely used, and both can reduce the risk of stroke and heart attack. But here's what many people don't realize. Their side effects are very different. One is known for causing swelling in the feet and ankles. The other is sometimes associated with a persistent dry cough. So which one is riskier? And how do doctors decide which one is right for you? In this video, we'll break down how amlodipine works, how losartan works, their most common side effects, and how they compare in real-world use. This video is for educational purposes only. It is not medical advice. Always consult your healthcare provider before making any changes to your medication. Let's begin. Amlodipine is one of the most widely prescribed blood pressure medications worldwide. It belongs to a group of drugs called calcium channel blockers. Here's what that means in simple terms. Calcium helps the muscles in your arteries tighten. When arteries tighten, blood pressure rises. Amlodipine blocks calcium from entering those muscle cells. As a result, the arteries relax and widen. When blood vessels relax, blood flows more easily. The heart doesn't have to work as hard. Amlodipine is also used to treat angina or chest pain because it improves blood flow to the heart muscle. Clinical studies show that amlodipine lowers systolic blood pressure, the top number, by about 15 to 16 points on average. Even a 10-point reduction can lower the risk of stroke and heart attack by up to 20–30%. So amlodipine is considered very effective. Now let's talk about the most important issue, side effects. The most common side effect of amlodipine is 1. Swelling in the feet and ankles, edema. This happens because amlodipine relaxes arteries, but veins do not relax in the same way. This imbalance can cause fluid to pool in the lower legs. About 1 in 10 people taking higher doses may experience ankle swelling. It's usually not dangerous, but it can be uncomfortable. 2. Dizziness. Because blood pressure drops, some people feel lightheaded, especially when standing up quickly. 3. Fatigue. Some patients report feeling more tired or sluggish. 4. Mild stomach upset. Less commonly, nausea or mild discomfort can occur. Most of these side effects are manageable. Sometimes lowering the dose or adjusting treatment solves the issue. Now let's look at losartan. Losartan belongs to a class of drugs called angiotensin receptor blockers, or ARBs. Instead of blocking calcium, losartan works by blocking a hormone called angiotensin II. Angiotensin II normally narrows blood vessels, signals the body to retain salt and water. When losartan blocks this hormone, blood vessels relax. The kidneys remove excess fluid. Blood pressure decreases. Losartan is also commonly prescribed for people with type 2 diabetes and kidney disease, patients with heart failure, stroke prevention in high-risk individuals. So it does more than just lower blood pressure. It also offers kidney protection. In clinical studies, losartan lowers systolic blood pressure by about 13 to 14 points on average. This is slightly less than amlodipine, but still highly effective. In real-world medicine, that difference is small, and both drugs significantly reduce cardiovascular risk. Losartan has a different side effect profile, dry cough. Some people develop a persistent dry cough. This side effect is more common with ACE inhibitors, but it can occasionally happen with ARBs like losartan. For some, it's mild. For others, it can disturb sleep and daily comfort. Dizziness. Similar to amlodipine, blood pressure reduction can cause lightheadedness, rare but serious. Angioedema. Very rarely, losartan can cause swelling of the lips, face, or throat. This is uncommon, but if it happens, it requires immediate medical attention. Mild fatigue or stomach upset. These are possible but usually mild. Let's put them side by side. Blood pressure control. Amlodipine. Slightly stronger average reduction. Losartan. Very effective. Slightly less potent. Swelling in the legs. Amlodipine. Common. Losartan. Rare. Dry cough. Amlodipine. Rare. Losartan. Possible. Kidney protection. Amlodipine. Neutral. Losartan. Protective, especially in diabetes. Risk of serious allergic swelling. Amlodipine, very rare. Losartan, rare but possible. The honest answer: it depends on the patient. Doctors consider age, kidney function, diabetes status, existing swelling history of allergic reactions, other medications. Sometimes doctors even combine both medications for better blood pressure control. There is no one-size-fits-all answer. If you are taking either medication, do not stop suddenly without medical advice. Monitor for side effects. Report swelling, dizziness, or cough to your doctor. Take your medication consistently at the same time daily. Remember, untreated. High blood pressure is called the silent killer because it damages blood vessels quietly over time. Medication, when properly prescribed, can be life-saving. Even with medication, lifestyle changes improve results. Reduce salt intake. Stay physically active. Maintain a healthy weight. Avoid smoking. Manage stress. Sometimes these changes reduce the amount of medication needed. Both amlodipine and losartan are safe and effective medications. Amlodipine, strong blood pressure reduction, higher chance of ankle swelling. Losartan, kidney protection, less swelling but a possible dry cough. The right choice depends on your overall health profile. Always discuss options with your healthcare provider. If you found this video helpful and educational, like this video, follow and subscribe to Pharma Health's channel, and share this video with someone who takes blood pressure medication. Thank you for supporting evidence-based health education. Stay informed, stay healthy. See you in the next video.